Tourette Syndrome. Tourette Syndrome, or TS, is a neurological disorder that is characterized by repetitive, involuntary movements and vocalizations called tics. The onset of Tourette Syndrome typically occurs in childhood, and the severity of symptoms can vary widely between individuals. Tics associated with TS can be either motor or vocal, and can range from simple to complex. TS is often associated with other conditions such as attention deficit hyperactivity disorder or ADHD, obsessive-compulsive disorder or OCD, and anxiety. While Tourette syndrome can be challenging to live with, many individuals with the condition are able to lead fulfilling lives with appropriate treatment and support. What are the causes and risk factors? The exact cause of TS is not fully understood, but it is believed to be related to abnormal functioning of certain brain regions and neurotransmitters. Research suggests that both genetic and environmental factors may play a role in the development of the condition. Some of the factors that have been associated with TS include 1. Genetics. It appears to run in families, and studies have identified several genes that may contribute to the development of the condition. However, no single gene has been identified as the sole cause. 2. Abnormalities in brain structure and function. People with TS may have differences in the structure and functioning of certain areas of the brain, including the basal ganglia, frontal lobes, and cortex. These differences may affect the way the brain controls movement and behavior. 3. Environmental factors. Some research suggests that certain environmental factors, such as prenatal and perinatal complications, may increase the risk of developing Tourette syndrome. 4. Gender. TS is more common in males than in females. 5. Age. The onset of TS usually occurs in childhood, between the ages of 5 and 10 years old. 6. Other conditions. Tourette syndrome is often associated with other conditions such as ADHD, OCD, anxiety, and depression. Having one or more of these risk factors does not necessarily mean that someone will develop Tourette syndrome. Many people with TS have no known risk factors, and the condition can sometimes develop spontaneously. What are the symptoms? The primary symptoms of Tourette syndrome are motor and vocal tics. These tics are sudden, repetitive, involuntary movements or sounds that can be difficult to control. Some people with TS experience only motor tics or only vocal tics, while others have both types of tics. Motor tics can include eye blinking, facial grimacing, shoulder shrugging, head jerking, arm or leg twitching, nose wrinkling, mouth movements, and finger or hand movements. Vocal tics can include throat clearing, coughing, grunting, sniffing, repeating words or phrases, yelling or shouting, barking, and coprolalia, sad face, involuntary utterance of obscenities or inappropriate words. Tics associated with Tourette syndrome can be simple or complex. Simple tics involve a single movement or sound, while complex tics involve a series of movements or sounds that may appear purposeful or goal-directed. Some people with TS also experience premonitory sensations or urges that precede their tics. In addition to tics, many people with Tourette syndrome also experience other symptoms, such as obsessive-compulsive behaviors, attention deficit hyperactivity disorder or ADHD, impulsivity, anxiety, depression, sleep problems, and learning difficulties. The severity and frequency of tics and other symptoms can vary widely between individuals with Tourette syndrome and may change over time. Is it curable? There is currently no cure for Tourette syndrome, but there are various treatments and therapies that can help manage the symptoms of the condition. Treatment for TS is typically individualized and may include a combination of medications, behavioral therapy, and support groups. Medications that are commonly used to treat Tourette syndrome include antipsychotics, alpha-adrenergic agonists, and dopamine receptor blockers. These medications can help reduce the frequency and severity of tics, but they can also have side effects and may not be effective for everyone. Behavioral therapy, such as habit reversal training and cognitive behavioral therapy, can also be effective in reducing the frequency and severity of tics. These therapies can help individuals with Tourette syndrome learn to identify triggers for their tics and develop strategies to manage their symptoms. In addition to medications and therapy, support groups and educational programs can also be helpful for individuals with TS and their families. These programs can provide information about the condition and connect individuals with others who are dealing with similar challenges. While there is no cure for Tourette syndrome, many individuals with the condition are able to lead fulfilling lives with appropriate treatment and support. It's important for individuals with Tourette syndrome to work closely with healthcare providers to develop an individualized treatment plan that meets their specific needs. Are THRE any complications? Tourette syndrome can sometimes be associated with complications that affect a person's physical, emotional, and social well-being. Some of the possible complications of TS include 1. Social isolation and stigma. People with Tourette syndrome may feel embarrassed or ashamed about their tics, which can lead to social isolation and difficulty forming relationships. 2. Anxiety and depression. Many people with TS also experience anxiety and depression, which can be related to the stress and difficulties associated with living with a chronic condition. 3. Learning difficulties. Some children with Tourette syndrome may also experience learning difficulties or attention problems, which can affect their academic performance. 4. Behavioral problems. Children with TS may also be at increased risk for behavioral problems, such as defiance, aggression, and impulsivity. 5. Injury. Severe motor tics can sometimes result in injury, particularly if they involve rapid, forceful movements. Individuals with Tourette syndrome to receive appropriate treatment and support to manage their symptoms and prevent complications. This may include medication, behavioral therapy, and support from family and healthcare providers. With appropriate care, many people with TS are able to lead fulfilling lives and achieve their goals. If a person with Tourette syndrome experiences a sudden onset of tics, there are several strategies they can use to help manage their symptoms. 1. Take deep breaths. Deep breathing exercises can help reduce stress and anxiety, which can exacerbate tics. 2. Relaxation techniques. Techniques such as progressive muscle relaxation, meditation, or yoga can help reduce stress and promote relaxation, which can help manage tics. 3. Avoid triggers. Certain triggers, such as stress, fatigue, or caffeine, can worsen tics. Avoiding these triggers as much as possible can help manage symptoms. 4. Engage in physical activity. Regular exercise can help reduce stress and promote relaxation, which can help manage tics. Additionally, exercise can help improve overall physical and mental health. 5. Use distraction techniques. Focusing on a task or activity, such as listening to music, playing a game, or engaging in a hobby, can help distract from tics and reduce their frequency and intensity. 6. Seek support. Talking to a friend or family member about the experience can provide emotional support and reduce stress, which can help manage symptoms. 7. Follow prescribed treatment plan. Following the prescribed treatment plan, including taking medications as prescribed and attending therapy sessions, can help manage symptoms and prevent them from worsening.